Hi, Dr. Nick Raza here, Santa Barbara Family Chiropractic, and we got a question on where do migraines come from, or what's the cause of migraines? They can be debilitating for sure. I mean, they can have collateral damage, impact families, ability to play with kids and be present, and productivity at work. Cause a lot of time lost from work from migraines. Just a brutal condition. So where it comes from? There's a lot of answers to that. Idiopathic, meaning medicine, we don't know. Science doesn't know. But really, most of these conditions, and migraines are part of this, is that they come down to one cause. It's stress. How much stress is your body under? Now, we think of stress as an emotional thing, but there's two other forms, and they're just as equally important. Chemical stress, the food choices that we make, there can be triggers from that. Pharmaceuticals or drugs that we take over the counter, that's a stressor to the system. And the one that I focus on primarily, and one that can be really profoundly impactful is the physical stress. Okay, so what your system is under, whether it's inactivity, so movement, too much activity, or the structure and alignment and function of your spine and your body. Okay, so we have a little chart here, essentially the law of health, stressors in the mind, stressors in the nutrition, broken the physical down into these two. Okay, and so how we identify in chiropractic, looking for physical stress that can really go, you don't even have to have pain for this, it can go under the radar. And I'll just give you guys a quick overview of how we look at this. But we're looking for stress in the central nervous system through position of the body. So you guys get that the brain controls all the functioning of the body, right? How it does that, sends electrical impulses or nerve energy through the spinal cord out to these nerve roots, takes it to the organs, tissues, body parts, all the cells. They all depend upon that energy coming from your brain through that system to keep you alive and healthy. Now, in life, there's stressors. Okay, now we're talking about physical stressors, things like micro trauma, which is repetitive poor postures at the desk, sitting, cell phone use, get your heart up, get your eyes up, don't be flexed forward like this all the time, iPads, travel, those are micro. Okay, so that means small repetitive damage to the joints. And there can be macro trauma, like a sports injury or a motor vehicle accident. And what that does is it can misalign individual joints or whole regions of the spine out of alignment. And that's called a subluxation. Okay? And there's a functional component and a structural component, so we need to understand that. So what we do is we identify this through initially posture and then probable x-ray. And when we have a misalignment at a joint, that puts pressure on the nerve, cutting off that energy there, cause symptoms there, or it can cause symptoms far away from that. So depending on where those nerves feed up to, different regions. And so what the most current research on headaches, migraines, shoulder, head, neck, sinus problems, all that region, it has to do with alignment coronally. So essentially, if you have a lateral translation like this, even upwards of 5 millimeters, more than that can cause significant problems. 5 millimeters, a quarter of an inch. Okay. Or from the sagittal, looking at someone from the side, which you wouldn't be able to see on a posture, or unless you had x-ray, is lost curve. So the spine should have a nice forward curve. Okay, it should have a nice forward curve here. And that absorbs shock, but most importantly, it relaxes the spinal cord. Okay, so when someone spends all day texting or in front of a computer, they can end up losing that curve system and even reversing it, called kyphosis. Okay, so that's where it goes the opposite direction. Really a disease state process, affects the spinal cord by stretching it like a rubber band. It gets tighter. That can actually pull all the way up into the brainstem and leave you susceptible for increased physical stress. So chronic all the time. And then you have, an overwhelming emotional stress, and it's additive.